Hi, my name is Dr. Isaac Ramirez, and I'm going to go over a medical report for my patient, John Doe. John is 45 years old, male, doesn't have any known allergies. He's got symptoms of pain in his upper abdominal region and back. He's got nausea, bloating, and heartburn. So we performed a physical exam on him, and so his vital signs, he had a temperature of 100.4 degrees, so he had pyrexia, aka a fever. His pulse was 101 beats per minute, blood pressure 140 over 90, so he had hypertension. He stands 5 feet 6 inches tall. He weighs 200 pounds. His BMI is 32.2, so he's got obese classification. His general appearance, I noticed that he had some pallor going on or pale skin, and he had a heart rate, like we said, 101, so he's probably got sinus tachycardia. He had normal lung function, but as said before, abdominals, he had pain in his abdominals, and he feels uncomfortable when sitting. His muscles, back and deltoid pain. And so, after reviewing his vital signs, I believe most likely has an issue with his digestive system. I ordered a CT scan and an abdominal ultrasound to be performed, and what we found was that he had stones in the gallbladder. And so the treatment I suggested to him was the diagnosis of being a cholelithiasis, cholelithiasis, which is aka gallstones. We're going to do a gallbladder removal surgery. And so, with reviewing the CT scans and abdominal ultrasounds, my patient does have gallstones in the gallbladder, causing his abdominal pain and other symptoms. I've decided to perform gallbladder removal surgery or cholecystectomy because my patient has a large stone of 3 centimeters in the gallbladder. Oral bile salt therapy was an option, but since we are dealing with a larger stone, it may take more than 6 months to work, and it has a 50% chance of reoccurring. So the procedure will be performed using a fiber optic kaleidoscope and to view the gallbladder, and then once we remove the gallbladder, bile will then flow directly from the liver into the small intestine rather than being stored in the gallbladder. And so typically post surgery, patients can experience mild diarrhea, but that can be solved using an over the counter medication such as Pepto Bismol. It's also important that the patient follows a low fat diet and avoids eating spicy or greasy food after the procedure. Recovery will take anywhere from 1 to 4 weeks, and we will schedule a follow up appointment about 2 weeks post surgery to see how things are going.